Good morning, everyone. Welcome to our virtual conference room. I'm Dr. Stewart, and I've dedicated my life to fighting breast cancer. As we know, early detection and diagnosis potentially save lives, yet our current system takes up to 6 weeks to confirm a diagnosis. This delay can be agonizing for patients.
Good morning, Dr. Stewart and viewers. I'm Mrs. Lee, bringing lean process expertise into the vital conversation about breast cancer diagnosis. 6 weeks is a considerable wait, Dr. Stewart. Could you elaborate on the factors contributing to these delays?
Absolutely, Mrs. Lee. The factors range from initial screenings and imaging to consultations, biopsies, and the final pathology report. There's a cascade of steps, each introducing potential waiting periods.
I see. That sounds like a classic pipeline with multiple bottlenecks. Do we know which stages are the most time-consuming?
Biopsy analysis is typically the slowest. Technicians must carefully prepare and examine tissue samples, which is time-intensive.
That's interesting. In lean processes, we aim to optimize the slowest steps first. Is it feasible in this context?
It could be. However, we must balance speed with accuracy. Our patients' lives depend on precise diagnosis.
Of course, and that precision is non-negotiable. But perhaps technology could expedite this without compromising quality.
Are you suggesting AI or machine learning, perhaps? They're revolutionizing many medical fields, after all.
Precisely. For instance, AI algorithms can assist pathologists by pre-analyzing biopsy slides and highlighting areas of concern. I believe this could be a real game-changer.
I've read about that. There's software that, when trained with thousands of sample slides, can identify abnormalities with incredible accuracy. That would indeed be a boon.
Let's hypothetically say we implement such AI technology. What other challenges would we face in our pursuit to shorten diagnosis to 2 hours?
Well, humans still need to confirm AI findings. We also need rapid and precise imaging, quick specialist consultations, and an efficient logistic flow of samples.
That sounds like it requires a cross-functional team co-located for rapid collaboration. A sort of rapid diagnostic unit, streamlined and efficient.
Exactly. And that's a beautiful vision. But changing the structure of most clinics would be a major hurdle.
Certainly, there would be resistance to change. However, the benefits would far outweigh the initial discomfort. Imagine, we'd go from diagnosing in 6 weeks to 2 hours. Reduced anxiety for patients, improved outcomes, and even cost savings in the long run.
It's inspiring when you put it that way. Could you offer a real-world example of a similar transformation?
Let's look at the automotive industry. It used to take months to produce a car. Now, thanks to lean principles, some facilities roll out a new car every few minutes.
Ha ha! I wouldn't want to roll out diagnoses quite like cars, but I get your point. Increased efficiency without sacrificing quality is key.
Exactly. And statistics indicate lean principles reduce waste by up to 30%. Applied to healthcare, that's not just cost-efficient, it's life-saving.
It's exciting to envision a future where technology and lean principles revolutionize our approach to breast cancer diagnosis. Prospectively, with a dedicated team, AI's analytical power, and a streamlined process, we can achieve 2-hour diagnoses.
And the impact goes beyond just time. It's about patient experience, confidence in the medical system, and ultimately, better outcomes. Thank you, Dr. Stewart, for this enlightening discussion.
Thank you, Mrs. Lee, for offering a fresh perspective on tackling these inefficiencies. Together, we can innovate towards a brighter future in healthcare.